New at 4, a new study by the CDC shows some parents are skipping routine pediatrician appointments as the pandemic wears on, and that means more and more kids are not getting the vaccines they need.
Okay, so let's talk a little bit more about this. Joining us now, Dr. Julie Holland. She is the Vice President of Pediatric Primary Care with the Chicagoland Children's Health Alliance. Welcome. Nice to talk to you.
Thank you.
Okay, let's talk a little bit more about this study. Why is it so concerning to you that these kids are not going at the scheduled time to get their vaccines?
So let me first say that parents are doing an amazing job during this pandemic. I mean, they're working at home, they're educating their kids. It's really impressive. And they've also done a great job of keeping their kids at home to protect them. But part of protecting your kids' health is getting routine vaccines. And there are as you mentioned, a recent study from the CDC, which indicated that a huge number of parents, somewhere between 30 and 80%, are not bringing their kids in for routine vaccines. Vaccines that protect kids against other health threats are just as important as protecting your child against corona. There are lots of diseases that children can get while quarantined at home and can get quite ill from. So it's really protecting your child, but then there are other diseases that the vaccine not only protects your child, but protects the community at large. It's called herd immunity. Right. And it's really important for protecting everyone, including those kids and adults who can't get vaccines. So it's not only doing a favor to your child, but it's really protecting the community as a whole.
Right. There are different schedules, birth, 2 months, 4 months, and they're all important, obviously. Are there some, though, that you feel are okay to maybe push out a little bit or stretch, and others that you think you really need to get?
Well, not really. You know, when we first started this pandemic, the recommendation from the CDC and the American Academy of Pediatrics was that we really focus on the 0 to 24-month-old children. And so we've done that. And now that the pandemic has slowed down a little bit, and we've realized that a lot of the older kids, the 4 or 5-year-olds, the 10, 11-year-olds, the 16-year-olds aren't getting their routine vaccines, we're kind of redoubling our efforts to get those kids back in the office. All vaccines are important. You know, before we had vaccines, thousands and thousands of kids died every year of preventable diseases. And some of these diseases they're still at risk for, even in the safety of their own home.
And talk about that, because you mentioned it in the earlier question that even though they're at home, they're sort of can't go outside and are keeping social distancing, it is still an issue. There are certain viruses or diseases that they can still get.
Absolutely. There are 2 different types of childhood pneumonia and meningitis that are much more common in 0 to 2-year-olds because their immune systems just aren't that mature yet. And so those vaccinations start at 2, 4, and 6 months. And some of those bacteria, their parents or anyone else could be carrying around asymptomatically in their nose or throat and not even get ill from. But a young child's immune system isn't all that mature. And because of that, they're especially susceptible. So some diseases you're not going to get while you're sitting at home, like, for example, polio. But there are a lot of diseases that you can get while sitting at home. And even with limited exposure into the environment, if someone comes into your environment or you pass by them with measles is incredibly contagious. And if your child isn't protected, it really poses a danger to them.
All right, a lot to think about. Thank you so much, Dr. Julie Holland, for your insight today. We appreciate it.
Thank you, Doctor.